So, let me introduce all of you first. Ruchi ji is a banker, and Rajesh is a financial consultant. Nandini is a psychologist and an event manager, young man, a bright young man. Anshuman is an architect. Well, Suruchi ji had a, unfortunately or fortunately, a cancer of a uterus. And we operated upon her about 5 days back. She's had a painless recovery, and it appears that nothing was ever done. So we thought that let's sit together and talk about basic concepts about this disease as well as about anything that you want. And we have a 10-15 minutes talk so that it's educative to anyone and everyone. You are all educated people, so you would have pertinent questions which can help anyone and everyone. Bataiye, any one of you.
Okay, like a journal question with any lady of my age will have, that how it was that after such a long duration that it was inside me and I didn't come to know. So, what are the awarenesses that should be taken, and how a normal man can come to know, and what all she should go ahead to catch it at an early stage or prevent it?
Very well. You see, the earliest symptoms of cancer are of every part. Earliest, like you had a cancer of uterus. Uterus cancers generally are caught early because they lead to a unusual bleeding pattern. So
Okay.
if you have an unusual bleeding pattern, you should, particularly it happens in postmenopausal ladies, but yours was not postmenopausal, you are still menstruating.
Yeah.
So postmenopausal ladies, when they have bleeding, they should get themselves checked up. And so uterine cancer is generally diagnosed in stage 1 and 2. But
Okay.
ovarian cancer is unusual. Ovarian cancer is called a silent killer because it keeps growing, 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 and till it has reached stage 3, it doesn't cause symptoms. So actually, unless you just as a screening once in a while getting yourself checked up, it wouldn't really come. You wouldn't come to know that
Okay.
ovarian cancer is coming up.
But in my case, because even the menopause was catching, and from last 3 to 4 years, I was going to gynaes.
You were having unusual periods,
Yeah,
and
and
the
I had
gynaes.
gone to gynaes. I told them, so I was always told कि this is just because menopause is going to start, so the period cycle is disturbed.
So had they done
So
an ultrasound?
no, it was
Suppose,
my last gynae in
yeah.
Dubai who saw me, and I told the same symptom to her. Within the first 5 minutes, she told, I want to do an internal checkup. And another 2 minutes, she was able to detect that something is wrong, it is not natural. So she asked me to go for an ultrasound.
So you see, unfortunately, you don't always land up with the right medical facility. And in India, particularly, there's a big problem. People come to us late. Why? Not because of their ignorance, really. They do go to doctors, but they are not doctors. They're quacks. And the quacks don't know that it could be cancer also. It's
Yeah.
again, it's not the fault of the quack. He is an uneducated doctor. And it's not a fault of the patient because the patient went to a doctor whom she thought or
He
he
is
thought is
educated
a
about
doctor.
it.
So that is why in India patients do get late. And then there is a class of people, doctors, so-called, who say that you should not go to a standard medical facility. You should not. Actually, you should continue to be taking some desi medicines and never go to these doctors because they will find out some disease in you which could have been treated by a desi medicine. No, this is unfortunate. We can't change that.
Unfortunately, in our case, that was not the case. We were going.
You were going to gynecologist, but still no tests was
No
conducted.
tests were conducted.
That's a bit unfortunate.
That is a bit unfortunate.
So, and then when we found out, when you came to from Dubai to me, only with an ultrasound, I found out it's a 30 mm
Yes.
thickness, which cannot be considered to be
Yeah.
normal.
No.
And so we got a CT scan done, or maybe I think I got a PET
Pet
scan
also
done
done.
very
Yeah.
early. And we said that you've got an ovarian cancer also likely, and uterine cancer also.
Yes.
This is a bit unusual.
Okay.
So, and then we straight away, I think within 4 5 days, we could, give you find a slot for you in surgery, and
Yes.
everything is done. It was now fortunate that you landed in the hands of a cancer surgeon.
Yeah.
I mean, to reach a cancer surgeon can take time. You for multiple referrals will take you to a
Take.
cancer surgeon, but here you directly somehow came to me, and we took the decision to remove the entire disease. We took out the everything that was involved.
Yeah, the good part was Dr. Sara from Sharjah. She actually said straight away, just straight away go to doctor. Don't delay anymore. Uh, and then that was the time when we decided either Bangalore or Dubai. Because a very close friend of mine is in Bangalore. He said, "Come there, good facility." And all. Then I ended up talking to Ranyal, Rakesh Ranyal.
So
That is the time he said, "You need not do anywhere. Straight away come to Talwar." And
because after all, go to a cancer surgeon. What else can you? Where else can you do?
actually, it so happened that we were mentally prepared for Bangalore. Then when talked to Ranyal, Ranyal said, "You go to Talwar, sir. Before half the disease will be over." Ruchi was just sitting there. Ruchi was just sitting there. That word actually made us to change immediately to Chandigarh. So Ruchi said, "Okay, Chandigarh."
And I think so. It was too less told by him. When I actually came and met you, वो जो एक अंदर से फील आती है ना, ओके नाउ यू आर इन गुड हैंड्स, यू नीड नॉट वरी, वो वाला था, सौंप दिया है, अभी भूल जाओ बस.
And I was telling
So it was
my
very
closest
effective.
friend yesterday, to whom you were going in Bangalore to stay. So I told him, see, that the only difference probably, and I was sharing him, and I told, look, till we got detected at Sharjah or whatever basic reason, until date, I have not referred any Google, any documents, nothing, just because of one thing, that we are in a good hands, and let's not use our brain in anywhere and try to read, and which we will not be able to interpret it properly because we are not from that field.
Absolutely.
So the same thing I told yesterday to a very close friend in Australia. His daughter is DM in anesthesia. So he was also telling his sister got operated yesterday in Bangalore on intestinal cancers.
Oh.
So we were talking to each other. So I told the same thing. He said, that's the best way. Just listen to one person, continue, and that's important. And that's where we found we are in a good hands, and we didn't want to read anything about it.
Now tell me any other questions. And when you come to us, your search should end when you search for the doctor who's going to treat you.
Correct.
Thereafter, leave it to him what is best for you.
This is what we have done.
You do have something in the deep down in the heart that in your case you did share with me that we would want an open surgery. Well, and I shared with you that in ovary, open surgery is the standard of care.
Standard.
In uterus, yes, I might have told you no, robotic would be better, and you might have agreed.
Sara actually guided us on this. Rajesh, do not tell just because of scars and all. Do not
No,
tell
don't worry about
short and all.
in cancer.
Go
Don't
long.
worry about
Yeah.
scars.
So next, her wife is don't accept or don't tell.
Yes.
Let the doctor decide whichever way, and good is open. And also from my side, take out cervix also.
Internationally, for ovarian cancer, we should do an open surgery. And for uterine cancer, these days, robotic surgery is very safe. Very safe. Any other questions? Nandini.
For somebody of my age, so we are just getting into, we're starting to live our lives independently. So, what are the vaccines or medicines or
Guidance,
yearly,
overall
monthly
guidance.
checkups that we need to do in order to ensure that we catch such?
Well, the one thing is about vaccines. Cervix cancer vaccine is available, and it is indicated actually as early in life as possible. That means at the age of 14, 15, it is indicated. Your age also, surely go ahead, get a cervix cancer vaccine. And besides that, cancers generally happen at a later age. So this age, just take care that you are healthy in the sense that you do not allow extra fat to build on you. Avoid obesity, stay happy, stay active, and don't worry about diseases. You are not supposed to at this age be worrying about diseases. If you can look after your obesity, that's good enough. That's good enough. Stay active. Do all your gymming, your yogasans, eat well, eat healthy, get up at the right time, go to bed at the right time, and live a productive, healthy, optimistic life. Not a scared life कि कहीं बीमार ना हो जाए. क्यों हो जाए बीमार? If you're looking after your lifestyle well. So if you have any questions on lifestyle, we can talk about that. But I wait for your questions.
But till what age can I take this vaccine? Because I'm 23 right now.
At 23, good, go ahead, take it.
And what about his age group?
He's a young man. He should focus his attention on how well what does he want to do in life rather than thinking about diseases.
No, should he take the vaccine?
No vaccines.
No vaccine.
There are no vaccines. There are no vaccines for him.
Only for females.
No vaccines.
Okay.
Anything else?
I think this is largely regarding, and now from here onward, health-wise, which otherwise also people should take care. One you said, vaccine is one, good health, not to increase the fat, or anything else can cause.
You see, anything else which I am there to, dispel any misconceptions. So if you have any misconception, if you think whatever you think, please discuss it with me. What is good and what is bad? Ask me.
During the biopsy, whatever the result comes, like what are the different types of cancer that might be?
In her case, we know that we have already done a frozen section. We know that the disease has come out into the lymph nodes. So chemotherapy is a must. So biopsy will tell us that there were two cancers, or one has gone to the other, or this one has come to this. I mean, is the uterine cancer which come to the ovary, or is the ovary which has gone this side, or ovary gone to the lymph nodes? That we'll come to know from the biopsy.
Okay.
So
And
that she
then
will get chemo.
depending upon that, the
will
number of
decide
chemos.
which chemo, ovarian-based chemo or a uterine-based chemo, and how many cycles. That will all depend upon the biopsy report.
Biopsy.
When we were saying in an operation, when the ovaries are involved, and when ovaries are not involved, then we can think of robotic or any other way.
Yes.
So in that case scenario, we take out only uterus and ovary remain there?
No, then also in her age, we would have removed the ovaries also.
Because the
She's
function
about
is no more
50.
required, yeah.
She's
I'm
about
53 plus.
53.
Because function is not
Yeah.
required.
So we should have and we would have removed the ovaries, uterus and the cervix,
Okay, yeah.
as well as the nodes, even if it was uterine cancer. Uterine cancer, we need to take out the nodes and prove that they are not involved.
Okay. I think that's all.
Anything else?
After the chemo, once the whole process is done, is there a chance of it returning?
You see, cancer is a scary word. It can come to anyone. Not necessarily that you are leading an unhealthy life, that's why, but it can come to anyone because it's a disease of the age. As we age, cancer can come to anyone. So a person who's had a cancer, depending upon the stage of cancer, it decides that what are the chances of its recurrence. Generally, stage 1 cancer, we are able to cure with a 80 to 85% certainty that it will not come again. And now your risk, suppose you were stage 1, your risk of developing a cancer is almost like anybody else. Anybody else can also develop cancer.
Yeah.
So you also have about the same risk because 80-85% chances we've cured you. And if this, as the stage keeps advancing, this percentage keeps reducing to some extent. So stage 2, 75%, stage 3, about 70, 65%,
Okay.
that way.
So from there onward, is it that we are required to cross-check later stage, say PET scan again? We have
No, that we are going to keep you under follow-up for 5 years.
okay.
Okay.
After 5 years, we call you cured from the disease which you had come to us for.
Okay.
After 5 years. We often talk about 5-year survivals in cancer. You might have heard of it. Now, 5 years survival doesn't mean that 5 years is the limit. 5 years survival means that after 5 years, we'll not consider you to be a patient anymore
Okay.
who
Okay.
requires any checkups.
Okay.
After 5 years, we say no checkups required. You can come and meet us whenever you feel like.
Done.
Independent checkups are still suggested so that you.
Yeah, that's what I said. Every 3 months for 2 years, every 6 months for 2 years, and then every year for about a year or two, and then SOS.
So now, once we get discharged, whenever the next 1 or 2 days, so after first checkup, first chemo is done after a month, 2 months, or how we are planning?
Chemo after 1 month of surgery.
After 1 month of surgery. That's how we will, again we will meet and then we'll plan.
Sure,
That's how.
sure. In a week's time, your reports will come, and we'll be able to finalize that yes, this is the chemo, this is the radiation, this is the time for chemo, this particular chemos, as many chemos will be given. All that decisions will be taken, but it'll begin after 1 month of the surgery, date of surgery.
And just I want to rest one line, as you said, if any apprehensions on thought process, there is no other way except chemo to take care in the world.
You
as
see,
of-
international protocols are followed all over the world. The same protocols. The NCCN is the word, National Cancer Comprehensive Cancer Network. They kind of give guidelines. All over the world, it is followed. And so you go to any country, you go to any cancer center, we'll prescribe you the same standard treatment. And up to stage 1, 2, 3, you should definitely, I as a mature with 40 years of my experience in surgical oncology, will advise you as an oncologist that up to stage 1, 2, 3, you should definitely follow the guidelines because they are internationally proven. In stage 4 also, we have got very durable treatments these days. Immuno, chemo, in people who have unfortunately stage 4. But if they ask me personally, and I'll confess, if they ask me personally, can they take some Ayurvedic, homeopathic, alternative, complementary, I don't stop them. Carry on with that also. Take our treatment and carry on whatever you think you want. I won't stop you.
Because at that time it's the satisfaction that matters.
Yeah, it's at that time very intelligent, because at that time in stage 4 your satisfaction also is very important. You should be satisfied because we also may or may not be able to help for very long in stage 4 disease. So then why don't you also try whatever you think can work or may work? And I am nobody to say it will not work.
Yeah.
No, if you are confident about something, your confidence can heal you.
Correct.
Your confidence is what I say is vitamin G, is vitamin God. Your confidence heals you. Your faith heals you. There's nothing stronger than your faith. Your faith can conquer even a stage 4. Okay? Anything else?
I think that's done.
That's done.
That's all?
Done.
Thank you so much.
Thank you.
You've done extremely well. I'm very happy. God is kind.
Thank you.
And you've
Thanks a
taken
lot.
it everything with a smile. From day 1, we never felt that you've had such a major surgery.
Yes,
Thank
it's
you.
your confidence.
I
that
was
made
in the
us
right
feel
hands,
that.
no, that's why. Thanks to you and your team. It was
Hare Ram. It's been my pleasure to have been able to do something for you. God is kind and we succeeded.
Thanks everything that you have done.